Thank you for joining us today. My name is Judith Goria, and I'm the Health Information Specialist with Brain Tumour Foundation of Canada. We are very excited to offer our 10th and final webinar of the 2013 Healthcare Professional Webinar Series. Today we have my colleague Trishna Wedemire joining us. Trishna is a registered social worker with her master's degree in social work who has been a member of the Programs and Services team at Brain Tumour Foundation of Canada since 2009. In her role as support services specialist, Trishna's main responsibilities include the development and management of the Pediatric and Family Support Program and Adult Support Group Program. Trishna obtained her MSW with honors from the Factor Indentush Faculty of Social Work at the University of Toronto and completed her clinical training at Surrey Place Centre at CAMH in Toronto. She also earned her undergraduate degree in honors psychology at the University of Western Ontario, bringing psychosocial expertise to the BTFC team. Trishna has worked with culturally diverse populations of children, adolescents, and adults dealing with a wide range of mental health and health issues over 10 years, and currently volunteers as the facilitator of a weekly support group at Hope's Garden Eating Disorders Support and Resource Center. She is passionate about research and the use of evidence-based practice to improve the lives of the people she supports. Trishna is also a busy wife and mother of 2 beautiful young boys and maintains a healthy lifestyle enriched by regular yoga and mindfulness practice. Welcome, Trishna, and I'll hand it over to you.
Thanks, Janik, for that lovely introduction. And it's really great to see so many other social workers online today for this webinar. So welcome, and hopefully I can provide you some tips when working with your patients and their families that can help sort out some of this madness through the hustle and bustle of the holiday season. So just waiting for my screen to change. So just a little bit more about me and sort of what I do here at Brain Tumour Foundation of Canada. As Janik said, I'm a social worker, and my title here is Support Services Specialist. So I'm one of 2 social workers that work here. My main focus is the Pediatric and Family Support Program, so it's called Brainwave, and we also do some groups for the caregivers of the pediatric patients. Also, I'm responsible for some of the support groups for our adult population in Ontario and New Brunswick. Myself and our other social worker, Koye, also provide one-on-one support through phone and email. And we also distribute a quarterly newsletter called Supporting You, which is an electronic newsletter. And for some extra tips and support articles that may be accessible to people who either cannot attend a support group or are in remote areas that there is no support group near them, or maybe they just don't have a good fit with support groups. So we like to make sure that there's other ways that people can access some supportive information and tips for getting through some of the stressors that can come along with a brain tumor journey. So I do have our 1-800 number listed here. These are the ways that you may direct clients to contact us on the support services team if they ever do need some extra support. And our email addresses are listed right there. If anybody is wanting this information at the end of the webinar, I can bring it back up. Or, of course, you guys can email me directly or email Janik, and we can provide you with some more contact information if you need it. So just going over some of the learning objectives for this webinar, it's our hope that by the end of the webinar, participants will be able to understand the issues and needs that can arise for brain tumor patients and their families around the holidays. Sometimes people don't even realize that there are these types of issues that can come up. The holidays are supposed to be this fun, happy occasion, and sometimes don't feel like these are the issues that they can even bring up with people out of fear of being judged or even some sort of guilt. So hopefully this will help you understand what can come up for patients. As well, we hope that you can feel confident about discussing the holidays with patients and their families and being able to start those conversations if you suspect that there may be some added stress that people are going through, as well as providing suggestions for coping with stress associated with the holidays. So just a little refresher on stress. So what really is stress? It's the physical and mental or emotional tension experienced when in reaction to an event. So this can happen all the time. When it can be a problem, it's experienced when we perceive demands exceeding our resources. So it's that feeling of how am I ever going to get this done, or feeling sort of like at a loss of power that I'm not sure what I can do to get these things done. And of course, it can be associated with parties, shopping, baking, cleaning, entertaining, all these things that can happen. So without the proper coping tools, we can let these perceptions or anxious thoughts get out of control. So no matter what you celebrate, holiday stress can affect most people. There are a lot of extra things that we do outside of our normal day-to-day activities during the holidays. So some of those examples, again, could be shopping, cooking, cleaning, visits to lots of different people and family, parties, getting those Christmas cards out, work obligations and celebrations through other means, and then also, decorating. All of these demands can be dizzying. We often have high expectations of ourselves or others, wanting things done perfectly, or the tendency to want to outdo yourself or others. Then you can add the demands of a brain tumor journey. So, the added stressors that can go along with treatments, the associated fatigue that comes out of getting to appointments and treatments, the limitations that can come with the brain tumor diagnosis, so physical and cognitive disabilities, as well as changes in diet due to meds, so worrying about what you can and cannot eat. Also the caregiver issues that could come up with being in charge of the care of somebody with a brain tumor. And we don't want to forget about issues of loss, or sometimes when people aren't around for the holidays. As clinicians and as people who are supporting the patients and families through this difficult time, it's important for us to help our clients understand and that these stresses can arise, as well as to validate the experience of the client and normalize this type of stress. I mean, yes, this is very overwhelming if you're dealing with all these different stressors and you've got a brain tumor, and then also the holidays are coming and everybody is expecting, or we perceive that everybody's expecting, that all these things need to be done. So how can we cope with this type of stress, and how can we help our patients understand that there are ways to cope? It's important to remind patients that there are simple changes that can alleviate unnecessary stress associated with the holidays. So it's not always something that we need to suggest therapy for or counseling. There are some little tips and tools that we can do so that we can help people be realistic about the holidays, as well as set some attainable goals that are important. These things are manageable, and then we can actually minimize the stressors in our lives, and then maybe even end up enjoying the holidays more than we thought we would. So we kind of eliminate that dread that can come with the holidays. So when we're trying to eliminate stress, one of the key factors in a lot of different psychological issues is prevention. Prevention is key with stress. For example, when stress is at its peak, I mean, it's very difficult to stop and regroup. We can often become overwhelmed by anxious thoughts. A lot of those would do, should do, or could do thoughts can come into play. There's a lot of judgment attached to these types of statements, and all of a sudden we can find ourselves thinking that we're not good enough, or that people won't have fun at our party, or that people will judge me because I didn't do the best gifts, just because we didn't do it a certain way, or we didn't live up to the expectations that we're placing on ourselves. So these types of overwhelming anxious thoughts can also lead to catastrophizing and other automatic thoughts. So when that happens, we can often find ourselves in a vicious cycle and then feel out of control. So what can we do to prevent this type of stress? We want to try to think about how we can encourage patients and their families to prepare for what is to come. We know the holidays are coming. We know that there's a lot of different things that are going to be expected of us, a lot of celebrations. Think about what is coming and maybe start to plan out what you might do as the holidays approach. Another important thing to do is to try to encourage your patients and families to reflect on previous holiday experiences. So an example would be if there has been a history of emotional toll that you've experienced, since the brain tumor diagnosis has come into your life. Then also, if you find yourself becoming overwhelmed by the automatic negative thoughts and catastrophizing, it's important to try to notice when you're being trapped in that vicious cycle of thoughts. When something like that happens and you notice that you're snowballing out of control, you can try to break the cycle by using a thought-stopping statement. So, you find yourself saying, if I don't get this done, everybody's going to be disappointed with my party. So ask yourself, so what? What does that mean? So then finally do something that takes your concentration away from those thoughts and maybe do something positive. Do something that can distract you from those thoughts. And maybe now your mind is clear and you can begin to tackle what needs to be done on your holiday list. So it's really important during the holidays to understand what some of those holiday triggers would be. There's a lot of different areas of our life that can be affected by stress during the holidays. So firstly, there's relationships. So all families have their conflict and have their different tensions. And this can be increased too during a time where somebody is unwell. So tensions are heightened. Sometimes family conflicts and misunderstandings can intensify. So whatever the reason for it is, you may find that there are people who don't want to go somewhere because somebody else is going to be there, or don't want to be sitting at a table because somebody else is going to be there, or whatever the case might be. Also, the loss of a loved one. Facing the holidays without a loved one, regardless of whether they're in the hospital or if there's been a death, or somebody right now is unwell and unable to participate in all the celebrations, or they're having treatments away, or maybe even people are traveling, it's important to consider that could be a holiday trigger for stress. Then there's finances. We all know that there's increased spending for gifts and food and travel and entertainment during the holidays. And then the physical demands that can come along with the holidays. So often there's extra shopping and socializing, so you're out and about more. Exercise and sleep can often take a backseat to the chores and errands that we feel we need to get done. And then so exhaustion can increase our stress levels and make us more susceptible to colds or illness. And so when we're stressed, we're getting sick. When we're sick, we're unable to do anything or get the things done that we need to do, and then we have more stress, and it's a cycle that begins to snowball out of control. So we've come up here in support services with 12 tips for coping with holiday stress, and these have just sort of been developed over the many interactions that we have with patients and families over the years in response to holiday stress inquiries. And of course, some of these strategies can also be applied to every day, not just the holidays, so any kind of stress that people that we may be supporting are experiencing. So here's the full list, but I will go through them in detail as we continue with the webinar. So number one, often people make lists of things we have to get done during the holidays. And so there's lots of things that we feel we need to get done, but sometimes the most important thing to check off your holiday to-do list is an entry that says do nothing. It's also important to encourage our patients and families that they are allowed to have days with no items that you have quote-unquote accomplished. It's okay to take a break. Caregivers and patients need rest. So if you have a day where you didn't get anything done on your list, that's completely acceptable. Something that I find helps with the patients that we talk to is often there's this idea of, oh, well, I can't do this anymore, and I'm not going to be able to do this, and because of my brain tumor, I'm always tired, and I can't get the things done that I normally do. So I like to encourage a new perspective for patients and families, which is relief. Now that you're either a caregiver or a patient that's experiencing this terrible journey, you can rest when you want to. You can have an excuse for having somebody else host the event, or now you have no reason to feel guilt over being lazy, as people may think. It's okay, again, to give yourself a break and to really take things slowly. And we usually demand much more of ourselves than others would. So it's important to be kind to yourself as you would to another patient or caregiver on the brain tumor journey. Encourage patients and families to really think about what they would do to somebody else who is coming to them, who is experiencing the same type of health issue and stress. So something really important to remember is to practice simplicity. I know everybody here probably remembers the acronym KISS, keep it simple, silly. I don't like to say stupid, as I guess that's the motherhood of two toddlers coming across with using nicer words. It's important to brainstorm ways to simplify the holidays by eliminating unnecessary expectations. So ask your patients, is it really necessary to make by scratch every ethnic recipe that's been passed down from great-grandma Violet, or to have the biggest display of lights or the most beautiful display of decorations, or to buy people the most and best gifts? And really, is it important to get to every celebration that you're invited to? Sometimes it helps to think of alternatives that are easily attained. So perhaps a gift exchange instead of having to buy gifts for everybody, or the pooling of resources. Let's all get together and have one celebration. Or if travel is something that your family is used to, maybe encourage everybody to pool those resources and do one trip together as a family. Sometimes by reducing the amount of things that we're doing, focusing on less tasks, you have more time to spend with your loved ones and be present. So you get this freeing feeling, and it adds to the richness of the celebrations. So less can really mean more. Another important tip is to encourage your patients and caregivers to be realistic. The holidays do not have to be perfect or live up to past years, especially now that somebody may be dealing with a brain tumor or the caregiver is caring for somebody with a brain tumor. There are a lot of other demands that may prevent you from being able to do the things that you've done in the past. So sometimes families grow and change as well. So now we've got different health issues to consider, but as families grow and change, so do traditions and rituals. So sometimes people who are unwell or unable to travel, if that's something that families normally do, or there may be people who are no longer with the family. So either through distance, again through the hospital, or having treatments, or even through death. Sometimes it's important to keep some of the traditions that we have had in the past. So maybe choosing a few to hold on to that are really important for the family, but then also being open to creating new ones. So just sort of making up for some of those differences that may have happened. So, you know, sharing pictures or videos or memories with people who may be at a distance, or if there's somebody who has passed away, to be able to do something to remember that person, something more memorial. Number 4, something that I try to encourage a lot with patients is to delegate, to ask for help. It's really hard sometimes for people to accept the changes that they've experienced now that they've become diagnosed with a brain tumor. Maybe their abilities have changed. As well as with caregivers, it can be difficult to balance all the day-to-day activities as well as with your caregiving responsibilities. So despite giving yourself permission to do less and to simplify life, it can still leave some things that are important for making the holidays special for you and your family, or for the patient and their family. So recognizing with the patient that it is important to acknowledge that these things are important to them in their celebrations. So it's just important to maybe ask for help for these preparations and plans if you still want to get specific things done. And if it's overwhelming for you to go and ask people yourself, perhaps assigning a coordinator, somebody that you trust, that can go ahead and enlist the volunteers for you. And also making a list of the things that you need help with. So most people in the family will want to help and want to feel needed. And it's important, though, to give them some direction. most of them will appreciate that direction on how to best help their loved one with a brain tumor or to help the caregiver. Because even though it's the holidays, people still have their specific ways or the specific things that they might want to do that makes them feel good about sharing this time with their family. It's important to have patients and caregivers feel comfortable with saying both yes and no. By learning to say those simple words without having to explain yourself or the guilt is important because it can be exhausting and sometimes awkward and increase stress levels when you're trying to figure out reasons to give for why you're saying yes or no. So what am I going to say so that they don't hate me for saying yes or no? Often there are the negative consequences to saying yes, so especially to unwanted activities. So if it's something you really didn't want to do or the patient didn't want to do, they can end up feeling resentful or even more overwhelmed than they were when they began. So some rules of thumb to encourage patients to say yes to activities that they're comfortable with. And this might be things that they had skipped out on out of feeling selfish or guilty in previous years, or maybe they weren't able to because of their illness. And then saying no to the activities that are on your mental should-do list. So activities that do not excite you or lift your spirits are probably ones that you can leave alone. So planning ahead. It's important to plan ahead so that we can feel prepared and so that we can feel like we're getting things done at a pace that's manageable for us. So important to encourage patients and caregivers to plan specific days for the shopping and the baking and the visits, for the things that they need to get done. And that way, if you do simple things and manageable things one day at a time, a lot more will get accomplished, and you'll still be able to give yourself that rest and to still simplify your days. So planning menus and shopping lists can be important. This can prevent last-minute scrambling and forgotten items, which can add to the stress. Equally important to enlist help for party preparations and cleanup. When we ourselves are either a patient or a caregiver, this extra party prep and cleanup can be extremely exhausting. And for people who might be traveling during the holidays, to be prepared for travel is very important for people who may have a brain tumor. There are a lot of things that you must remember, so maybe consulting with your doctor to talk about the travel needs, as well as making sure that meds and health records and phone numbers are easily accessible, so that when you're already traveling, we're not scrambling for these types of things if an emergency does arise. Often there are financial burdens associated with a brain tumor diagnosis. Money can be a very sensitive issue for most people, especially during the holidays, but even more so if you're now out of work and unable to have the same funds that you did when you were working full-time. As well as sometimes caregivers need to pull back on their work as well so that they can take the time to care for the patient. So money can be a very, very difficult issue when there are so many things to do that cost money during the holidays. So what can we do to help that? Perhaps encouraging your patients and families to make a list of people to buy for and to really be specific. So decide on how much and for who you will be buying for. Again, if you make this type of list, it's important to stick to the budget that you've decided on. Otherwise, going outside of that can sometimes add to that stress, and then, again, you're back to square one. Also, maybe thinking about some gift alternatives that can help save money. Donating to charity in someone's name, or even homemade gifts that have a lot more personal meaning to them, or even a family gift exchange, which a lot of families are starting to do now, can help alleviate some of that. It's important to remember that you don't have to try to buy happiness with an avalanche of gifts. Remember, the holidays are about spending time with the family and being able to share. So as we discussed before, that there can be some familial conflicts that can come up during the holidays and trigger some extra stress. So one of the tips that, that can be helpful are to set aside differences. So trying to accept family members and friends as they are, even if they don't live up to all your expectations of the season, or even some of your expectations now that the person is a patient or a caregiver. Setting aside grievances until a more appropriate time for discussion. Is it really, ask yourself, is it really appropriate to be bringing up some of these conflicts during a family gathering? Also, encouraging patients and caregivers to be understanding that if others get upset when something goes awry, because, again, others may be feeling the effects of holiday stress too. So a little bit of putting yourself in other people's shoes as well. Again, remember the holidays are meant to be spent time with family and loved ones. So why waste that time over some of these grievances when we could be sharing the memories? So maintaining a regular routine of eating and sleeping can help eliminate holiday stress. And this often can fall lower on the priority list for many people during the holidays. But it's equally important for people undergoing treatments to consider this, especially when we know how our bodies and circadian rhythms can respond to different kinds of treatments. It can be tricky to get the right balance when you're on different types of drugs. And, you know, this requires consistency in some way and regularity. So you don't want to veer too far off of whatever your healthy meal and sleep plan is just because it's the holidays. So we want to try to encourage patients and families to refrain from overindulgence, as overindulgence can lead to guilt and stress and can have negative consequences for people with compromised health. A way to do this is by having healthy snacks before parties so that you don't have the tendency to go overboard on sweets, cheese, drinks when you're at the party or the gathering. And remember to continue to get plenty of sleep and physical activity despite the holidays. Again, this all goes hand in hand. If we are overindulging, then we'll feel like we don't want to do as much physical activity, and then we may not get as much sleep. So again, don't compromise your health for the sake of the season. The season is meant to be enjoyed. So something that comes up often is the whole idea of taking a breather, taking a break. It might sound really simple, but it's one of those things that people just tend to forget to do. I'm sure that everybody here can relate to, you know, not stepping away from their desk to take a break at lunch, or just working through breaks and things like that. So it's the same thing that we want to try to encourage with our patients and families. Whether you're at a gathering, or whether they're during their events, or running errands, or completing preparations, it's very important to encourage people to make some time for themselves. It can be anything from spending 15 minutes alone doing whatever it is that helps to sort of come back down and sort of de-stress. It's most important to make sure that you do this without distractions. So if you begin to feel overwhelmed, some things to do could be, you know, to actually step out of what you're doing. So whether it's at a party, you know, excuse yourself. Just step outside, take a walk. If it's nighttime, you can stargaze, or there's lots of Christmas lights that can be looked at. You can do this with a buddy if you feel like it. You know, listening to soothing music is another suggestion that works for a lot of people, and there's lots of joyful music that can be played during this time. Then there's also sort of the concrete stress reduction techniques, you know, taking some time out to do some brief mindfulness practice, or to focus on your breath, or deep breathing, meditation, visualization, and you know, pretty much anything that the person feels is important to them, or that helps them feel a little bit more calm. So just spending that 15 minutes alone without distractions can sometimes refresh you enough to go back and handle everything that you need to do. We want to encourage patients and families to remember to honor their emotions and acknowledge the feelings that they're having. So we know that the brain tumor diagnosis and brain tumors are a heart-wrenching disease, and always close that mind for those who are living with it or lost with it. So it's important to let clients know that these emotions are normal. So the types of emotions that they may be feeling could be sadness, grief, and frustration, and they are even amplified during times of celebration. So these thoughts may travel to days, the thoughts that they may be having may travel back to days before the diagnosis, when there wasn't a lot of limitations and they were able to do all the things that they like to do at the holiday time. Also, they might reflect on how their life has changed now and sort of the things that they're unable to do, and then to the future. So how many years do I even have left, and what's it going to be like when I'm not here and I'm going to miss my family, things like that. It's important to have these patients and families recognize that these thoughts are real, and that also that you want to encourage them not to hide these feelings just for the sake of protecting others. Because when we keep things bottled up inside, eventually it's going to come out, and it might not be done in such an adaptive way. So again, letting clients know that it's okay to cry and express your emotions. And this can also help normalize the feelings for other people that are around you. So maybe there are other family members that are also not feeling too good about, missing their family member or the things that they used to be able to do with the patient. And by expressing their emotions, they may actually leave it open for other family members to be able to also express how they're feeling. It's important to let them know that they don't need to be afraid of ruining the holidays for others. So when people express their feelings, the loved ones can welcome your honesty. They likely will welcome your honesty, because then everybody's being open about their emotions, and it can be the greatest gift that you can give, since the expression of sadness can give people to express their freedom as well, and then everybody is able to fully enjoy each other once some of this is released. So tears can be healing as well. So, thinking about the memories of people, or to think about different memories that have happened, even if there hasn't been any loss, can really help shape some family bonding. And then you want to avoid forcing yourself to be happy just because it's the holidays. Just because it's the holidays doesn't mean you're not allowed to feel some of these emotions that are very real. So something that you might want to encourage with your patients and families is consider the question, when is it important to recognize that your stress may go beyond what can be alleviated through self-help and familial support? So the types of things that we've been talking about today. We'll usually have them think about some of the things that they may be feeling. So despite their best efforts, anxiety, sadness, or maybe even depression start to persist. If they notice that they're being plagued by physical complaints, they're unable to sleep, so experiencing some insomnia. Irritability is an indicator of this type of issue, as well as feelings of hopelessness, and just the inability to face routine chores. So they're not getting out of bed, they're not being active, they're not being interactive. When these things are prevalent, we want to help clients understand that this prolonged stress is a problem, and that it's important to seek professional intervention, especially if these things are persisting for an extended period of time. So what does all this mean? We're hoping that we can encourage our patients and families to take control of the holidays. Remember, the holidays are a time of joy and a time for family, so don't let the holidays become something that you dread. When you start to dread a celebration, then really how important is it that you actually celebrate that thing? Taking the steps to prevent stress that we discussed before can really help with experiencing a holiday that is enjoyable. And then learning to recognize those triggers before they lead to a meltdown. Nobody wants to become overwhelmed and feel like they're unable to do anything. So again, recognizing those triggers and learning to prevent the stress before it happens. And hopefully with a little planning, support, and positive thinking, we can help our patients and families find comfort, peace, and joy during the holidays instead of worrying about all the things that they feel need to be done. So that brings us to the end of our webinar. I just wanted to give everybody an opportunity to ask some questions, or if there is anything that we can maybe answer for you. So I'd like to give you guys the time now.
Thank you so much, Trishna. And there aren't any questions that have come up yet through the question section of the webinar, but we'll give everybody a moment. If you do have a question for Trishna, you can type it in the question chat area, and we can let her know what your questions are. And it doesn't look like that that anybody's typing or anybody has any questions. So is there anything else that you'd like to add, Trishna?
I can't really think of anything now, but other than going back to, let me see, I'll just go back to my slides with the contact information for myself and Koye, because even though we will be closed for most of the holiday season, we want anybody who is on the webinar right now that may have some patients and families that could be, seeking extra support and help to be able to contact us if they've got that. So just before I head that way, I just want to thank everybody for participating, and I'm wishing everybody and the people you support a safe and joyful holiday season.
Great, thanks, Trishna.
You're welcome. I'm just going to go back to that slide just in case anybody wants to take down that information. And then, of course, if anybody here has any questions or comments that they'd like to, address to me, feel free to contact me, individually if you'd like to, too.
Sure thing. And actually, one question did come up, and the question was, can participants get a copy of the PowerPoint presentation?
Absolutely. We can definitely send that out. I know, Janik, you've got a list of all the people who are registered, so that's completely fine. And, I hope that people do use the tips and pass them along to the patients and caregivers that they're supporting, definitely.
Sure thing. So we can get that organized and sent out to those of you who have signed in as well. Because the webinar has been recorded, it will be up on our website, usually within a few business days. And you can go back and listen to the presentation. You can refer the presentation to your patients and your families as well. And once again, a huge thank you to Trishna for taking time out of her schedule to present for us today. And you provided us with a lot of great tips and suggestions and lots of great information. So thanks again.
It's my pleasure. Thank you.
All the best, everybody.
Giving me the opportunity.
Thank you.